there, everybody. Dr. Aimee Ostick here with Health and Healing Direct Primary Care.
I'm Dr. Brian Ostick, emergency medicine.
And it is Friday, May 22nd. And we will be talking today about something that I've received a lot of requests to speak on, and that is
MISC, or multi-system inflammatory syndrome in children. It's spelled MIS-C.
right. Also formerly, as of really last week, called PIMS.
PIMS, P-I-M-S.
Then prior to that, Kawasaki-like illness.
Or inflammatory syndrome post-COVID infection.
Right. And really what this is, where this all started was the end of April. There were reports coming out of the UK and New York of a cohort of kids that expressed this rapid inflammatory response after a coronavirus infection. As of now, CHLA is investigating 3 cases, what they diagnosed prior as Kawasaki disease.
Right.
And they went back and did coronavirus testing on them, either through antibody test or through PCR, and discovered they were positive.
And they had seen at CHLA this rise in Kawasaki-like illness that was much more than had been at the same time last year.
Right.
And they said, could this be related?
Right, exactly. Kawasaki disease, a pretty familiar syndrome, especially here in California. We see a lot of Kawasaki, and it's typically at summertime. We usually see that it's an inflammatory response. We don't really know actually the underlying etiology of Kawasaki disease. For many years, it's really been assumed that there's been a viral source.
Right. So
And
what we see
now-
in the emergency department when somebody comes in with Kawasaki-like illness or Kawasaki syndrome is fever for a prolonged period of time, usually 5 days or more, cracked or red lips, strawberry tongue, which is a bright red tongue that looks like a strawberry, in a child, in the pediatric population. We don't see this in adults, we really only see it in kids.
Mm-hmm.
And then with this new thing, this MISC, they're seeing similar type symptoms. Fever for multiple days without another source, the red and cracked lips, conjunctivitis of the eyes on both sides, maybe lymph nodes, swollen lymph nodes, and then a strawberry tongue. So
Right.
it's very similar in appearance, and then there happens to be this infection with COVID-19, either by PCR, by antibody testing, or by a known exposure within the past month to somebody who was definitely diagnosed with COVID-19.
Right. This MISC is really being diagnosed in the inpatient setting because technically the CDC criteria are that these kids are requiring hospitalization. They're pretty acutely ill.
These kids are sick.
These kids are pretty sick. This is not your outpatient, oh, I think it's a little MISC, take a Tylenol and go home.
Right.
I mean, these are kids that usually have prolonged fever, although technically the criteria just say they have to have fever, but it's prolonged fever. They're pretty severely ill, so they, maybe they can't tolerate oral or hydration at home, or the blood pressure is low, or their heart rate is high, or their oxygen is low, something that is requiring them to be in the hospital. And then when they're in the hospital, they're working this up further. They're getting blood tests that can be elevated, sometimes called a CRP in these kids. They're doing chest x-rays. Also, and there's no other underlying source, right? So they're not,
right.
It's not a urine infection, it's not strep, it's nothing. So they ruled all that out. They have these, 2 or more organ systems involved.
Right, it's multi-system, so it's gotta be 2 or more organ systems.
Right.
So respiratory system, or cardiovascular system, or skin involvement, or renal failure.
Oh, renal failure, right. And so the concern also is what we see in Kawasaki disease on the outpatient side after they come home. What we have to monitor for coronary artery aneurysms or cardiac disease. So we do serial ultrasounds with these kids for a certain period of years to make sure that doesn't develop, because we think there is in Kawasaki kind of a vasculitis that happens, an inflammation in the wall of the blood vessels that leads to downstream some concerns with the heart. So that would be something similar that we're not sure yet, but that's what maybe we would have to monitor with MISC as well.
Now we have 3 kids, 10, 7, and 6 years old at home. What's their risk of getting MISC?
Very low. I mean, really and truly, what we've seen just under 200 cases worldwide and a total of 5 deaths. So even if they get Kawasaki disease or MISC, they do pretty well, right? They get IVIG, which is an IV immunoglobulin to help them fight off the inflammation in the hospital, and they do pretty well. But in general, if just getting this rapid inflammatory response, we don't know why some kids get it. There's no real pre-existing condition per se.
No, we don't know.
We don't, healthy kids get it. Some kids just behave in a very strange way to these viral infections. Their immune system just goes haywire. So very low risk in general.
Now, the vast majority of kids are going to, if they get COVID, are going to do just fine. Some kids haven't even had symptoms when they've had COVID, and the ones that have had mild infections, fevers, maybe a cough, but we really haven't seen any sick kids in our emergency department with a COVID-19 infection.
Right. So, and that's good news. What can we do to really prevent your kids from getting MISC? Well, everything that we're doing to prevent coronavirus infection, which is washing your hands, wearing your face mask, and respecting kind of social distancing guidelines, because what we do know is it really is close contact, prolonged close contact via respiratory droplet is how we're getting this infection.
Right.
It's not through touching surfaces. It's not through, running and jogging on the street and walking by somebody that has it. You really have to have a prolonged close contact respiratory droplet exposure. So that's kind of, those are the same types of preventative tools that we're using.
Sure.
Still apply here, which is good news. I mean, I think the transmissibility of this virus, we were worried about it being so infectious, and now with newer literature coming out, we really can, if we stick to these social distancing guidelines and mask wearing, we can really prevent the spread.
And wash your hands.
And wash your hands. But you don't have to bleach wipe your groceries.
No.
Please stop doing that. There's no need to. We worry so much about the anxious response to this infection and the sequelae that can cause too.
Now, if you have any more information or looking for more information, we got a lot of our information today from Children's Hospital of Los Angeles website, and we will link to the CHLA information on MISC so that you can get more information if you want.
CDC.gov as well. This is Dr. Aimee Ostick at Health and Healing Direct Primary Care. We are here for you. If you need anything, please give us a call, 818-600-2426.
I think your website is also www.healthandhealingdpc.com.
It is.
Is that right?
Right.
And if you have a child who gets sick, and we recommend that you call your pediatrician or your family medicine doctor if you have one. If you don't have one, please consider Dr. Aimee Ostick, as she is open and accepting new patients. And because she's a family medicine doctor, she will see anybody from newborn to the very elderly. So she takes care of everybody.
All takers.
Thanks, Dr. Ostick.
Thank you, Dr. Ostick.
Take care.